Stanley and Daphne Mashile, Daphne Nkosi Foundation, I beg your pardon, have launched a state-of-the-art facility at the Chris Hani Baragwanath Hospital. That's in Soweto. It's the second biggest hematology and oncology pediatric clinic in Africa. Let's talk about this project now. We're joined by the Foundation's Dr Zakhele Mashile. Doctor, a very good evening to you. Thank you so much for coming in tonight. So what prompted you to pour into this particular project?
Good evening to yourself and good evening to your viewers at Newzroom Afrika. Thanks for hosting us. I think the history is that my sister Zakhele Nkosi passed on in 2016 at the tender age of 19 from a rare blood disorder. And then after that tragedy, Mrs. Daphne Mashile Nkosi saw it fit to actually see to it that other South Africans who are less fortunate than ourselves, we have the resources, but we couldn't save her life. And then she said she's going to do something in her name so that at least other children will have the opportunity that my sister didn't have to give life.
And you talk about people who are less fortunate, and that would explain, I would imagine, why you've chosen to take this to Bara, which is right in the middle of Soweto.
Yes, Bara is the third largest hospital in the world. They run the biggest oncology center in the continent. Mm-hmm. So, it makes sense for all of us to actually put more effort to actually try and improve Chris Hani Baragwanath Hospital with all the challenges that we have in the country and the state of the hospitals that we see in our country. So it's important that she saw it fit that she actually puts her money where her mouth is. So she's done that. We opened the first phase in 2019. It's been in operation for 3 years. We opened the second phase last week. It's a pediatric oncology clinic, and we hope to do the third phase and the fourth phase.
And what have been your main observations since the first phase in terms of the difference that you've been able to make in the community? I mean, when we talk about oncology, it's a set of health services that a lot of people aren't exposed to until they get a diagnosis, and sometimes it's too late.
Yes, I think the biggest thing that we learned is that a lot of people actually arrive when it's already late. So it is important that the diagnosis is made early. And the fact that, we have enabled the hospital to actually be in a position to administer those treatments that they were no longer administering, like stem cell transplants, which require specialized conditions. So we've provided those conditions. Bara today is able to administer stem cell transplants at the institutions. Last year we did 25 stem cell transplants. Of those, 23 were successful, almost 90%. So that's a good number, if you compare with the rest of the world. So we are doing something positive. Maybe at a different time, you can actually yourself, you can go and interview the professors at Bara. They'll tell you the same thing.
And of course, when it comes to healthcare, it's one thing to provide the services, but the service often has to be paired with an education drive to allow people to understand what is offered and why it's important to indeed come forward when you realize that there's been a change physically. Yes,
the fact that I'm here and you are here, we'd like to call upon like-minded South Africans to actually go to these hospitals, Bara itself, familiarize themselves with what we are trying to achieve, and actually assist all of us. At the moment, we have a lot of people who have come out to actually support us. The National Rural Movement of Rural Women has actually contributed last week 5 million rand towards the reconstruction of Ward 1, which is a trauma unit at Bara. Bara runs the biggest trauma unit in the country, but the infrastructure is in a dire state.
Are you funding all of this?
Yes.
On your own?
Most of the money, yes, has been funded by Mrs. Mashile Nkosi. And some private donors have actually assisted as well, but the majority of the money is her own money.
And Bara, as a public facility, I want to talk more about the public-private partnerships and how we can do more of that when it comes to healthcare.
It is very important because me and you, at the moment, we are able to pay medical aids, but when our medical aids run out, we end up in those hospitals. That is why it is important to make sure that we work together. We combine all our efforts to try and assist, because we know our situation in the country currently. And it's not only about Bara. This thing is happening right across the country. So we call upon everyone, all South Africans, to assist all of us to actually make things better for all of us.
I know you intend to expand in a third phase even going forward, but in terms of capacity now, just remind me of how much you're able to do in terms of staffing and space for patients to come in.
Yeah, phase 1 is actually a clinic plus a ward. It's a 20-bed facility. It's highly specialized isolation rooms. We've got about two, like one side for females, one side for male. We've got about 10 ventilators, 8 active ventilators, and 2 on standby. We have dialysis machines, because often than not, those patients actually require both ventilators and dialysis. So we've enabled that capacity. So it is possible, we can do it. I mean, we've got the people, all we need is the equipment and the infrastructure.
So in terms of phase, the next phase after this that you're hoping to get off the ground, ultimately, what are you hoping for when all these phases have been completed?
Ultimately, we want to develop a third phase is actually building an adolescent ward for oncology at Para. Fourth phase, we're building a research center where we will actually capacitate the institution to actually develop research and improve treatment for patients.
So, and I want to talk about that then, bringing in the young people from a community such as Soweto. I mean, many of them, yes, come in as patients, but people are also exposed to different professions as well in the science and health space, are they not?
Yes, they are. We have a campaign called Vuga Para Vuga. We're launching the campaign because we want all Sowetans, all South Africans to come together, and we want to make sure that we give information to people, young people, different sets of skills. You don't contribute monetary only. People have lots of skills, advertising, marketing, yourself. It is important. I mean, what you say on TV, people listen to you than me. So it is important.
I was going to say I can only come in as a communicator because my math and science marks don't allow me to do much else.
No, for sure, for sure. So we want everyone to assist us because in the end, this thing is going to assist all of us.
Mm-hmm.
Yes.
Dr. Zakhele Mashile, it's so good to have your time and all the best with everything that you're doing.
Thanks very much for allowing us the opportunity.
That's where we will leave News at Prime. South Africans in their different corners doing their bit for the benefit of each of our neighbours, and we hope that this inspires you as well to make a difference.